My name is Dr. Vishal Saini. I'm a fellow of American Academy of Sleep Medicine, which was just conferred to me in 2025. I'm a board-certified sleep physician and has been the president of Michigan Academy of Sleep Medicine for the year 2024-25. I've been practicing sleep medicine since 2014, and we would love to help our patients in tackling their sleep disorders. We are a full-spectrum comprehensive sleep clinic with 4 locations, one in Lansing, one in Traverse City, Eaton Rapids, and Charlotte, and we serve Midwest community. We're also actively participating in sleep clinical trials, especially for our narcolepsy and hypersomnia patients. So please check out our website at mwcsd.com for more information. Masks are important for CPAP use. CPAP is a small little pump that takes room air and forces that air with some pressure to help keep our upper airway open, which in our patients with obstructive sleep apnea tend to shut down when they're falling asleep. So CPAP takes room air and forces that air with some pressure. So the mask helps us attach the CPAP to the patient's face, and that's really why we need masks, and it's a critical piece of CPAP therapy. We live in wonderful times as far as CPAP masks are concerned. We have several different options. In fact, I won't be wrong if I said there are close to 20 or more mask choices out there for our patients who are struggling or are in need of new designs. Most of the modern PAP therapy or CPAP therapy mask designs have gotten very, very small. The first one that comes to mind are the CPAP mask pillows. We call them pillows, I'm not sure why, but these are the masks that kind of snugly sit in my nostril, and they are very small in size. And they come in 2 different forms, the one where the pillows sit in the nostril and the hose is coming at the top, and then there are pillows where the hose is coming at the top of the head, so that when I'm laying back, the hose stays behind me. So those are the 2 main versions of the nasal pillows, and there are different brands out there that make these pillow designs. The next design that's out there that's fairly new are the nose cushions, and these are the nasal masks where the cushions just snugly sit under my nostril, and generally it'll have a single hole or 2 holes that align with my nostril, and same as the pillows, the hose can be at the front or the hose could be at the top. Depending on whether I'm a back sleeper or a side sleeper, I can choose those different mask designs. The third mask option that is really modern and that has really shortened the size of the big bulky mask of the past are the ones that snugly sit under my nose and cover my mouth. And this is especially good for patients who are mouth breathers, but they don't want to have a big bulky mask on their face, and that's what they tend to prefer. And one of the newer models, it's called F40, is an example of that. And generally we would measure you for the size and then fit you with that mask. So those 3 are really the new modern mask designs that everyone should be aware of. Mask cushions and headgear needs to be replaced every so often. Why? Because if you do not replace them in a timely fashion, the leak from the mask can go really high and it can impact your treatment or your therapy and sometimes even your pressure needs from your CPAP machine. So how frequently should one replace these? Generally, it depends on the type of mask you're using. For example, if you're using nasal pillows or nasal cushions, then the most common recommendation is to replace them at least once or twice a month, depending on how the seal is feeling. For the bigger masks, for example, the full face mask, generally that recommendation is once a month. The headgear tends to stay on longer, and usually I would suggest replacing it every 6 months, because a lot of these headgears are made of Velcro, and once the Velcro stretches out, then it's not going to fit your head very well, and it will lead to more leaks. So those are general recommendations for how frequently one should replace the mask cushions and the headgear. There is a common misconception in our field, and a lot of times I see DME companies telling patients that, hey, if you get switched to a BiPAP machine, which stands for a bi-level PAP machine, which is generally an upgrade from a CPAP machine, because most likely you're needing a little bit stronger pressure from your machine. And the general misconception is that, hey, you're going to need a much bigger, bulkier full face mask, and you won't be able to use your nasal pillows or nose cushions if we were to switch you to BiPAP, which I want to bust that myth today, and I would suggest to stick with the mask that you have found and love, that you were using with your previous CPAP therapy, and no need to really change unless it's detected during the sleep study or on the advice of your sleep physician that the mask needs to be changed in case they're noticing a lot of leaks on your PAP download data. Our office staff is really well equipped with helping you select newer mask choices that are out there in 2025. And we would love to help you in case you're struggling all by yourself. Do not do that. Please call our office, reach out to us. We have a lot of mask samples, newer designs. We can fit you with a mask. We can fit you with a sample design and send you home with one to try for yourself and see if you would love that mask design. In case you're wondering, is this it? Am I stuck with the CPAP mask for the rest of my life? You've probably seen ads on Inspire Implant Therapy, and I'm happy to report that I'm one of the first sleep physicians who introduced Inspire to our sleep apnea patients in Midwest region. And that could certainly be an option as a treatment for your obstructive sleep apnea. So let's say we try several different masks, or you've tried that outside of our clinic and you're wondering, is this it in 2025? Do I not have any other options? Please call our office and we can talk all about options for sleep apnea outside of the CPAP. For example, Inspire Implant Therapy, oral appliance therapy, and so on. We have a cool new website, mwcsd.com, and feel free to check it out. We have a patient contact form that you can fill out, and our staff will promptly try to get hold of you and reach you to schedule the appointments. Our phone number is also listed with directions to our offices. So please check out our website, mwcsd.com, for more information.